Cystic fibrosis is a genetic condition commonly fatal among Northern Europeans. Symptoms include struggling to clear mucus from lungs, which lead to infections, lung damage, and it reduces your life expectancy. People who have CF or cystic fibrosis require constant monitoring and visits to doctors on a daily basis to make sure they're okay. And what we want to change is how we monitor cystic fibrosis. Basically, the idea is to create technology that can better improve our cystic fibrosis care. For example, we can, since cystic fibrosis, you have to go see a doctor or visit a nurse on a common basis. We can try home monitoring, either monitoring their healthcare, their lungs, in a way that they don't have to constantly go there, and we can also keep track of them at the same time.
In the article about technology in chronic healthcare provision, people who live with chronic conditions like asthma, diabetes, and cystic fibrosis would find technologically enabled self care to be important in providing clinicians with electronic health records that can change their interactions and treatment decisions with the clinicians. The process of information collection, synthesis, and interpretation are especially important in cystic fibrosis because of how it can potentially transform the structures of chronic health care provision. Medical professionals have been using health information generated by patients to obtain a better understanding of the cycles of chronic illness. Home-based and wearable technologies like Apple Watch came across challenges when sharing and using patient-gathered data, such as the challenges with their successful integration into clinical workflows and technical, organizational, and social.
In order to get a personal idea of cystic fibrosis care, a research team took into account the perspective of both the patient and the multidisciplinary team that they had. The purpose of the conversations that were had with the patient was to get a better understanding of their lived experience while under the care rather than just looking at their experience from a clinical perspective, meaning maybe just looking at numbers or deciding whether something was positive or something was negative. Interviews were done to get this better understanding and to develop concrete concepts about the care. This was purposely done as the team was utilizing the grounded theory approach for their research. Transcripts of these interviews were used to cluster the different words that they found within the transcripts from the conversations that they had with the patients and the team to find a specific theme. And I think that this is an efficient way to get as much data from the research as possible, rather than simply having one question and finding ways to use that data to be tailored to the answer they want. So I think this kind of refrains from any type of bias coming from the results. It allows for not only the main question to be answered, but may spark new ideas about topics that were initially not at the forefront of the study.
Hi, I will introduce the telehealth programs today. Although some patients and providers still prefer the old-fashioned and in-person doctor-patient consults, it's a trend that telehealth programs are popular now and affecting more and more people. The reason behind it can be staffing challenges, the tension on value-based care, and new policies. Nearly half of the respondents interviewed claim that they are involved in these programs. However, there are some challenges of the development of telehealth programs. The first one can be the limitation of secure text-based and communication platforms for provider side. Last but the most serious challenges are on the patient side. It can be the lack of access to electronic devices like smartphones and computers, the lack of confidence in safety and security of virtual care, and also the lack of technological knowledge to connect with the electronic devices. In conclusion, despite the challenges, telehealth is a trend now to improve healthcare conditions, better monitor at-risk population, and expand the health programs.